Hi, I'm Michael White and I'm a doctor of physical therapy. Today we'll be reviewing exercises for seniors. Typically the exercises are performed with support at the counter with 2 chairs positioned the way we are today, a cane, a walker, any other supportive device that you have around the house. These exercises are designed to improve your balance, your strength, in order to prevent any falls or any future falls. So starting with simple toe raises. You're going to put 2 hands on the back of the chair, going up onto the toes and then back down. Simply repeating the exercise about 10 reps and then taking a break. Now we'll be showing you how to do toe lift-offs. Toe lift-offs consist of raising your toes off the ground, putting your weight through your heels. Again, repeating about 10 times. And your hands are there for support. We will be reviewing toe to heel rockers. This exercise consists of going up onto your toes, shifting your weight and lifting your toes up onto your heels. Again, up onto your toes, shifting your weight backwards onto your heels so your toes come off. You will likely complete this exercise about 10 times, and then taking a break as needed. We will now perform marching. Marching consists of holding on to the back of the chair, lifting your knees to the back of the chair, and tapping. If you feel that that's too challenging, just lift your knees at a less height. You will want to complete 10 reps on each side before you try to take a break. We will demonstrate the single leg step back. This exercise is performed with single arm support, and I'm going to demonstrate how to do it stepping back with your left leg. You will step back and forward, repeating about 10 times. Completing the exercise this way has a nice wide base of support. If I step back with the other leg, this might be slightly more challenging because you have smaller base of support. If you would like to complete with a larger base of support, stepping back with the right leg, simply turn around and support yourself with your right hand. Single leg balance should be started with bilateral hand support on the back of the chair. You will raise one leg and hold for 10 to 30 seconds. And then simply place back down. A progression of that would involve dropping one hand and lifting one leg. Again, trying to hold for 10 to 30 seconds. We're going to review Tandem Stance. Tandem Stance is a higher level exercise that should only be completed if cleared by your physical therapist or if your balance is adequate enough. Typically, I would recommend that a patient have someone around just to supervise the first time. You'll simply face the chair, 2 hand support, putting one foot directly in front of the other, heel to toe as if you were on a tightrope. Trying to maintain that balance for 10 to 30 seconds. If that exercise is too challenging, just take your foot and step a little bit out to the side. Again, trying to hold 10 to 30 seconds. Then switch legs, putting the opposite foot in front of each other, as if you were on a balance beam. Next, I will be demonstrating the progression for sit to stands. Sit to stands are an excellent exercise to help strengthen the entire lower extremity. The first exercise will start with both hand support in the chair. Simply allowing your hands to help as you stand back up and then sit back down. You'll typically complete this exercise about 10 reps during that process. When this gets too easy, you can use single hand support. Again, this is a progression. The last exercise would involve no hand support. It involves putting your hands across your chest. Simply lean forward and then push up and rise from the chair. And then coming down slowly, ensuring not to plop back down in the chair. These exercises are typically completed in reps of 10 for a total of 30. Single leg sidestepping is completed with 2 hand support. You'll sidestep to the left, back to the center, sidestep to the right, back to the center. You can alternate that exercise. completing about 10 steps to each side before you were to take a break. Reviewing strengthening exercises of the hip. Simply have two-hand support. The first exercise will be hip abduction. I'm going to demonstrate that on the left leg. All you will do is lift the leg straight out to the side and then bring it back to center, placing your foot back down on the ground. It's important that you want to try and keep your big toe pointed straight ahead while performing this exercise. You complete about 10 reps and a total of 30 before you might take a break. Hip extension is also an exercise to help strengthen your glutes or the proximal muscles of your hip. Simply start with two-hand support, bringing your leg straight back and then bringing it back down on the ground. It's important to note that your knee should remain straight and your trunk stays completely upright while performing this exercise. This is hip extension. Squats are also another exercise group that can help strengthen the proximal muscles of the hips. Holding on with two-hand support, you are simply going to pretend like you're going to sit back into a chair and then rise back up. The deeper you go, the harder the squat. It's important to note that you want to make sure your knees do not come over your toes while performing this exercise. Balance exercises are typically completed in 10 to 30-second increments. Strengthening exercises are typically completed in sets of 10 for a total of 30. If you have any questions, you might want to consult your physical therapist in reviewing these home exercises.